Mr. Speaker, I rise today to share with you and the House of Representatives real stories from people of Colorado, their own personal stories of why we need health care reform in this country. A constituent of mine, Bill Semple from Boulder, Colorado, shared a compelling story with me that I feel will help encourage my colleagues on the House of Representatives to support health care reform. Bill writes that he's known for a long time that the problems in our multi-payer system are resistant to change, but he feels we just need to change it. His story that he shares is in his professional experience as a psychotherapist. Bill is a psychotherapist in private practice, and he has a lot of experience billing health insurance companies. He shared with me that health insurance companies haven't raised their allowable limits for outpatient psychotherapy for 15 to 20 years. Because they have behavioral carve-outs to policies. This adds another layer of bureaucratic expense. Another 20%, and they're already 30%, a total of about 50% overhead. Bill spends hours hassling with them. Any mistakes that they make always seem to be in their favor. This is time away from his practice, away from seeing patients, away from his family, just dealing with health care insurance. And by the way, those people on the other end of the line working for the health insurance companies, they're being paid salaries, they're costing money too. So when you're paying your premium, some of that is also going to those very people that are arguing with providers over what's covered and what isn't covered. Bill shared with me that frequently the insurers only have to pay what kicks in after a sky-high deductible for the year is met. Preferred provider networks, in Bill's opinion, really have phantom lists. They look good, but they're often made up of providers who are gone, moved out of town, or deceased, or aren't really even accepting that particular insurer. Bill shared with me that single-payer financing is best, but second best is a robust public option that people can buy into regardless of their status. I hear a lot of frustration, not just from families affected by loss of health care, by worrying about losing their health care, but from providers in our current system. Doctors overwhelmed with paperwork, taking money, time, and resources away from their practice, away from patient health, simply to fill out paperwork for insurance companies and battle them over what's reimbursed. By creating real competition in the insurance industry, we will give providers the ability to pick insurers that are easier to work with, that have streamlined procedures. The exchange will allow for a standardized procedure across the insurers, and practitioners like Bill Semple and many others across the country will have cost savings that they can pass along to their customers. Thank you, Mr. Speaker.